a few more people. Keep an eye on the waiting room because I think a few more people may come in, but I don't want to cut into our time anymore. So thank you everyone who's joined us today. Good afternoon. This is a very important webinar. We're excited to share boosting our communities for a healthy holiday season. And I just am going to start that over again because we are not recording. So I'm hitting recording. Good afternoon, everyone. Thank you for joining us for this very important webinar, Boosting Our Communities for a Healthy Holiday Season. My name is Lauren Rao, and I'm the Program Director of the Vaccine Literacy Campaign at the CUNY School of Public Health and Health Policy. I'm pleased to be co-hosting this webinar with Harlem Health Initiative, also at the school, and Ryan Health, a valuable partner of the campaign. So before we get any deeper into this webinar, I want to point out that we have live interpretation available in Spanish, and you choose this at the bottom of the screen. You choose your preferred language by selecting the interpretation icon. It's a little globe, and choose Spanish. We don't have a picture of it, of the globe icon, but hopefully you can find it. So thank you to those who are listening on the Spanish channel. And we are recording this in English and Spanish, and we will make the recordings available following the completion of the webinar. So we're grateful to everyone who's joined us. Thank you for your attendance. And as a reminder, at the end of the webinar, we will do a raffle drawing for a chance to win a $50 Amazon gift card. So stay tuned because we'll draw those names at the very end and we'll announce the winners. And before that, we are fortunate to have an esteemed panel here with us to answer your questions and share their guidance, and each of them will present in a moment. So first, before we launch our presentations, I'd like to take a quick poll of the audience and see what's brought you here today. So the poll should pop up on your screen, and just take a second to answer. Hope everyone can see it. I see some answers coming in. We'll give you a few more minutes. Okay, I'm gonna wait for like 50% to answer. And we'll get a good percentage. All right, thank you to those who answered. Let me share the results so we can all see. It looks pretty evenly split between people coming today to look for more information about the booster, the bivalent COVID-19 booster, and also as individuals who work with community members, they want to help answer their questions. So that's great, welcome. And I'm going to close this. Great. So now I'm going to turn to our panelists to each give a brief presentation based on their knowledge and expertise. Our first presenter is Dr. Roshana Lynch. Dr. Lynch is the Chief Medical Officer at Ryan Health. Dr. Lynch directs clinical functions, including overseeing medical staff, developing and planning health services, and achieving clinical quality goals. She has set up, implemented, and enhanced the highest standards of professional medical care for patients and provides medical leadership in identifying and implementing ambulatory care services that meet the needs of Ryan Health's patient populations and the communities they serve. Throughout her tenure at Ryan Health, her steady leadership and superb clinical skills have set a high standard for supplying quality care for her patients. We are so excited to have you here with us today, Dr. Lynch, and I'll hand the floor over to you now to speak to the latest information regarding the updated bivalent booster vaccine.
Good afternoon, everyone, and thank you for having me today to discuss the bivalent vaccine, which are really important to the community. You can go to the next slide. My first slide is basically just letting you know that in September of 2022, that's when the CDC made the new recommendations for individuals to receive the updated booster. The word bivalent is used. It's a bivalent booster, meaning that there are two variants of the virus, the COVID-19 virus, that are included. Unlike the monovalent primary series, which came out, which means it was only the original COVID-19 virus. So the bivalent virus actually protect us against the original COVID-19 virus, as well as the variant, which was called the Omicron variant, which was very prevalent within the last winter of 2021. The bivalent booster definitely is really important, and it's recommended for 5 and older. So if you are 5 and older and you received your primary series or you received a monovalent booster, it is then recommended that you have a bivalent booster 2 months after that. So this slide basically is just to show you the types of bivalent boosters that are on the market. The first one is the Moderna vaccine, and that one is recommended for patients and individuals 6 and older. And the bivalent Pfizer is for 5 and older. So those are the two differences between the bivalent. It is not recommended for anyone below the age of 5 at this time. And children 5 to 11, it is still recommended that they receive that monovalent booster and then 2 months later receive the bivalent booster. So why is it important to get vaccinated? Why is it important to get boosted? The CDC has reported that New York State has had 14,000 new COVID cases within the week of October 26th. So it just goes to show that this pandemic is not over. We are still having a lot of New Yorkers get infected with COVID. So it's really important to get these boosters. Because we know that over time, the protection that the vaccines give you, it wears off. So any immunity that you've received by getting the vaccines wears off. So that's why it's important to get the boosters. Much of New York State is experiencing medium community spread, while some are also experiencing high community spread. So that's another reason why. We are not getting vaccinated or getting our boosters as rapidly as we were when the primary series came out. So only 7% of New Yorkers have received the updated boosters. So it's really important that we get that word out that they are available. So this is just a little slide to show you that flu is also important. Flu vaccines at this point in time is really important because flu is seasonal and we are definitely within the flu season. It's actually widespread right now within the state. So the triple threat of RSV, COVID, and flu is actually occurring right now. The hospital rates for children admitted to hospitals with RSV has increased. We're seeing more cases of flu. And as I mentioned previously in my other slides, COVID is also on the rise. So we want to make sure that we get our flu vaccines and we get our updated COVID boosters.
Great. Thank you so much, Dr. Lynch. I don't love the phrase triple threat in this context, but very, very good for us to know and to know that what might be coming down the pipeline. So our next presenter will be Laura Lagunas. Laura is a program manager at the Public Good Projects. She currently leads the NYC Vaccine Hesitancy Program, which aims to build a sustainable network of CBOs and community influencers to equip New York City neighborhoods with accurate and real-time messaging around COVID-19 and flu vaccines. Laura received her master's in public health at the University of Pennsylvania and a Bachelor of Science at Cornell University. So thank you for being with us, Laura. I look forward to hearing your guidance on communicating about seasonal boosters.
Awesome. Thanks so much, Lauren, for the intro. Yeah, I don't think I need to tell anyone here that the city has experienced its fair share of public health emergencies. We talked about COVID, but also monkeypox, polio, and as Dr. Lynch rooted to this, the upcoming flu season. So today I'll be highlighting some quick messaging and tips around, specifically around the COVID-19 bivalent boosters and flu shots. But first, who are we? What do we do? Taylor, if you can go to the next slide. Thank you. PGP is a public health nonprofit. We specialize in health communications. A lot of our work encompasses large-scale media monitoring, where we identify vaccine-related misinformation circulating across regions in the US, and we develop materials and trainings to combat that misinformation. So for the last year, PGP has worked with local partners in the city and other states to provide COVID-19 and flu communication support to CBOs. Next slide, please. Yeah, so Dr. Lynch gave an excellent overview of bivalent boosters and reasons for getting them. This slide provides a simple and brief talking points for boosters that you can embed in a social media post or a newsletter or whatever medium you use to update your communities on the latest health information. So here I just have 3 main talking points. So the bivalent boosters give you greater protection, longer protection, broader protection. And again, this is intentional, that it's very brief to the point. You can even create one bullet and embed that into a post, like a weekly post. So the first one could be greater protection. That's like Monday. And then the following Monday, you can talk a little bit more about why it gives longer protection. So again, these are just basic examples for how you can simplify and unpack messaging around the boosters. And so to the right, the image to the right is an example of a rapid response graphic that PGP made for CBO partners in the city to download from our resource library, along with a proposed caption copy for a social post, specifically on Instagram for this graphic. So we strongly encourage partners to reframe the caption here in their own words based on what might resonate best with their audience. But again, we are just trying to provide some examples of quick and factual talking points. And next slide. So I have some suggested talking points for the flu vaccine. Many may not realize this, but a lot of people get sick and even hospitalized each year from the flu. And particularly this year, case numbers are higher and earlier compared to the past 2 pandemic years and even prior to the pandemic. Flu vaccines can be detected, or excuse me, flu viruses can be detected up to 5 to 7 days after becoming sick. But most people are most contagious in the first 3 to 4 days after symptom onset. Some individuals can be infected with the flu and have no symptoms, but still spread the virus. So similar to COVID. And the optimal time to get vaccinated is September, October, early November. Everyone 6 months of age and older are recommended to get a flu shot. And to maximize protection, scientists have modified the vaccine every year to protect against the 4 influenza strains, expected to be the most common during this upcoming season. And while we do have rapid response assets for specifically the flu vaccine, I wanted to give another example of how you can approach disseminating health messaging online. And Taylor, if you can just click the image that'll pop up here. Thank you. So for the last 4 years, PGP has worked with social media influencers across the country to talk about the flu vaccine. So this image here is specifically from a campaign called Stop Flu, and it's supported by Kaiser Permanente. So while it's great to have a rapid response social asset to caption and upload as soon as possible, especially when misinformation is circulating, you wanna make sure that message is the correct messaging is out. We do believe that there is a lot of value partnering with an influencer like Malay here, where she has had the creative freedom to share some of the talking points that we've provided along with her own words, and sharing like reasons why she decided to get vaccinated and why it's important to her. So this kind of partnership goes a long way and is able to reach larger audiences online and in general as well, compared to, let's say, a health department, sending out those talking points about the flu on their Instagram account. Now, that's still super important. We still need, health departments to be able to disseminate, the information. But there is something about, someone like Malay here, being able to basically, use their own like creativity to share their reasons for getting vaccinated. Not to mention, whoever's following her may already look up to her in some way. And, they are going to think twice about getting vaccinated, that's for sure. Whether or not they actually make that concrete step of getting vaccinated, we've definitely found evidence where people are at least thinking, they're going from being like very hesitant to thinking a little bit more about it. And so there's also more authenticity in this type of messaging as well. And this actually leads to my last section of the presentation. Taylor, if you can go to the next slide, please. We can give you all the talking points here, the data to equip you based on, or to share with your communities, but based on my professional and personal experiences, presenting the facts alone do not lead to behavior change. So I wanted to go over some quick tips on how to center trust and connection during challenging vaccine-related conversations. And I'm sure many of you have already applied these tips and live them out every day. So feel free to use the chat too and share some of your own experiences and what's been helpful to you in communicating and having these really tough vaccine conversations, whether it's about COVID or flu or polio, et cetera. So next slide. Yeah, so it can be really easy to just tell someone first, like why they should get vaccinated. But yeah, part of having a genuine connection with someone is trust. And I argue that, the feeling of trust is rooted in being seen and heard. And so I just really want to emphasize like that is part of the power in connecting with someone, is that as a trusted person in your communities, or Malay's example earlier, she has like a really substantial following, that like she has some sort of connection, with her followers, and that already gives you a leg up in being able to have a more one-on-one genuine conversation, with whoever is feeling a little bit hesitant or has questions about getting vaccinated. And so I just want to emphasize, that prioritizing those one-on-one conversations and listening first is so important, and that being quick to listen instead of being quick to respond. And later on, asking maybe some more open-ended questions to better understand the roots of people's concerns. And understanding like where that hesitancy may come from. And next slide. So from there, just finding common ground. So, as you're having those one-on-one conversations and you're listening first, you may be able to find some shared values, some identity, some shared experiences. And so from there, you can further develop trust and understanding when you share something in common. So for example, I'm Mexican and Navajo from both my mom and my dad's side. And so like being able to have some conversations like with other family members, like around their hesitancy about the vaccines, like just the lack of trust in like the medical community at times, like because Native people and people of color in general, like have had some pretty horrific experiences with the medical community. But because like I've been able to, understand both perspectives, like me being in the public health field and also identifying as a Native and Latina woman, like I can just have like a better understanding of both of those perspectives and being able to have genuine conversations. And there's still some of my family members, even after talking to them, still feel very much like set in their ways, and that's okay. And like that kind of leads to my next slide here, that ultimately the choice is theirs. And so like it it really is a process. Building trust is a process. So be positive, be patient, and know that like sometimes it's just about like showing up, and it might take a year, if not even like a couple of years, for someone to really make that decision in themselves. And so some of the partners that I've worked with in the city have discussed the importance of someone like a community health worker. And I know Shameka is going to talk about that later, but community health workers and outreach staff in combating misinformation and building confidence in COVID-19 flu vaccines are so important. And they've noted that staff members are the most equipped to having those one-on-one genuine conversations with the community about their concerns. And they also have explained too that it takes repeated conversations, like repeating just yourself to show up to address those concerns about the vaccines. And so I know that can take a lot of patience, a lot of resilience. And so I definitely commend people who are in that field that show up every day for their communities. And so essentially, just starting off with understanding and listening, and just saying, I'm here to listen, please consider me a resource. And then with that, I just wanted to quickly share that if you like any of these graphics that have been throughout my presentation, all of these graphics are actually free to download by CBOs. So Taylor, if you can go to the next slide. We do have a download center with the following resources. We actually have resources like from CUNY on here as well. We do cover a variety of topics, but again, any of the graphics that you've seen on this presentation are available to download. And thank you so much for your time.
Thank you, Laura. That was such a great presentation. And I really appreciate the acknowledgement that the mass communications and the general information coming from health departments is important, but this empathetic sort of one-on-one approach is so complementary and important as well, especially for people who have very personal questions and concerns. So thank you for that. And it's a wonderful segue to our final panelists, Shameka Shannon, a community health worker who will discuss why vaccines are important for the health and safety of community. Shameka is a community health worker supervisor currently working at Harlem Congregations for Community Improvement. Her job is to provide leadership to a 10-member community health worker team that is creating change in underserved communities by identifying healthcare disparities and other barriers that NYCHA residents are faced with. Previously, Shameka worked at NYU Langone Hospital as a community health worker, where she received extensive training in addition to her previous training from LaGuardia Community College. Shameka is graduating next year with honors from Strayer University with a degree in Health Office Administration. Congratulations, that's a big achievement. And she is a parent who grew up in NYCHA housing and remains a NYCHA resident today. I'm sure I speak for all of us when I say we look forward to hearing your insights on promoting community health. Shameka, the floor is yours. Thank you.
Thank you. So hi, my name is Shameka Shannon, as she previously introduced, and one of the questions that came across to me was they want to know the strategies for vaccines and boosters that I use when I'm engaging. So I start off, I'm honest. I let them know that at first, when it first came out, I was very apprehensive, like a lot of people were. I was scared. I did my research, but what also helps me relate to the people is picking back when Ms. Laguna says that I'm African American and I work in underserved communities. So I work with Latino, I work with African Americans, so I can relate. So I understand the hesitancy and, being scared of taking it. So I let them know what I went through and what helped me to get vaccinated, which were my kids, because I wasn't going to do it at first. I was scared. And, I have a son who has severe asthma, and everybody knows that COVID affects the upper respiratory system. So I thought about my son, and even if he was vaccinated, if I'm not vaccinated, I could bring it home and impact him. So that ultimately helped me to get vaccinated with my youngest son. Here.
Great. Thank you, Shemeka. Can you talk a little bit about some of the conversations that you've had with other people? Oh, well, actually, I think my question is more about, is that how you've made connections, is sharing your personal decision making and the fact that your son was central to that?
Yes. So actually, when I was at NYU, I did a tabling event, and of course, we was promoting vaccine and we was promoting boosters. And one lady, she was adamant, like, I'm not getting vaccinated. This is something I'm against. And well, we're trained, we can't force them. So I listened to her and I asked her, why? Why don't you want to get vaccinated? And she said, they putting stuff in our body and all type of chemicals, and the vaccine came up too quick. So I told her that, I felt the same way, which I honestly did. And I told her after doing my research, they already was prepared for some of this. So that's why the vaccine came across quick. And then I told her about the situation with my son, and she was there with her daughter, and she was just watching her daughter. And she said, you know what, after thinking about what you're saying, and a lot of people, because she told me that her aunt passed, but she still wasn't too sure about getting the vaccine. But after I explained to her the situation with my son, and she's also related because her daughter had bronchitis, that's what made her go get the vaccine. Because ultimately she didn't want it like me. But once, her daughter had bronchitis, and I told her the situation with my son, and we spoke about other people we know who was close to us who passed, she thought about, getting it. Then about when I came about, I don't want to say about 2 weeks, maybe about 2.5 weeks later, and I was doing another table event, she told me that she did it. She didn't have no side effects, and she don't know why it took her so long to get it. So it actually came out a success story. And I kept in touch with her for the whole duration of when I was at NYU.
That's a great example of exactly what Laura was talking about, how it might take a longer conversation and building trust over time. And it's great that you were able to build that relationship and help someone.
And I explained to her the communities we live in, especially because I live in East Harlem, but I serve the Bronx area. And I explained to her that these are the areas that are the highest risk of asthma. So if that's already affecting a lot of people in the community, imagine impacting that with COVID. So that's what, helped us. And that's what also helps me when I go in the field and I speak to people, because a lot of people in our community have asthma, and it's severe. So once I speak to them about that and upper respiratory, they get it. Some people are still apprehensive, and some may say no. But a lot of them, once you figure out, they say, yeah. Then I also, what helped me with the youth is they have grandparents that a lot of them live with, and they don't want to affect their grandparents. And, some of them also, to be honest, want to be social. They felt, especially at the height of COVID, if they wasn't vaccinated, they couldn't go outside and be social. So I used all of that and listened to them, and I helped a lot of people to get vaccinated and even boosted. Because it took a while for me to get boosted too. But I was like, hey, I'm out here and encouraging people to get boosted. How can I not do it myself? So that's what made me do it.
That makes a lot of sense. You're helping
Sorry
people.
about my background, everybody. I'm in the field, so if my background's a little noisy, it's because I'm engaging. My apologies.
No, you sound perfectly clear, and we're so appreciative that you could carve out the time. I know you have a busy day.
Of course.
And it sounds like you help people find their personal reason why, which is really wonderful to hear.
Yes.
I think we can move ahead to the Q&A portion, and we'll get to hear more from Shemeka as well.
Okay.
During that. So we collected questions from the audience ahead of time, and we also included some frequently asked questions as well regarding seasonal vaccines. So many of these questions are medical, which is understandable. So I have a few to start with, directed towards you, Dr. Lynch, if you don't mind starting. So the first has to do with some confusion around how to define your COVID-19 vaccine status, because with the boosters and now the bivalent booster, understanding what fully vaccinated has changed over the last year or so. So one audience member asked, if you do not get boosted for COVID-19, so you've received just the original course, are you still considered fully vaccinated? Would that still apply?
Yeah, absolutely. So if you've received 2 doses of the primary series, you are considered, that's what's considered as fully vaccinated. But we know that you don't have the same protection as you did if you received that vaccine, let's say a year ago. So the vaccine status, yes, you are still fully vaccinated, but you do not have the same protection if you do not receive your booster vaccine.
Mm-hmm. So boosters are building on that original protection and helping to sustain it.
Absolutely. Over time, your protection wears off. So that is the reason why we need boosters. The other reason why we need boosters is because the variants change. So the COVID-19 virus has mutated in a way where it can evade the original vaccine. So that is why we need to update ourselves with the updated boosters, because not only does it help us address our decreased immunity, but it also helps to protect against those new variants that are coming out.
Mm-hmm. So this next question is a sort of similar, but this is someone asking if they recently if they recently caught COVID-19. So if you remember the spring and summer wave of Omicron, if they recently had COVID-19, do they still need this bivalent booster?
Yes, and that is because the natural immunity is very important, and we want people to understand that our bodies do react when we are exposed to a virus. So you do have natural immunity, but you still should be boosted. And you can wait 90 days to receive that booster, because after those 90 days, that natural immunity is starting to wear off. So that is the reason that even if you have been infected with COVID-19, you still require a booster. You would just wait 90 days from either the point when you tested positive or when your symptoms first started.
Okay. So if you were sick in July, you'd be wanting to get your booster around now.
Yes.
90 days. I'm counting the 3 months. Yeah. Okay. Good to know. And for individuals who follow the news on COVID-19 closely, which I understand if people are tired of that, but they may have heard of what sometimes is being called the Scrabble variants, or all of these new mutations that are still technically Omicron variants. Currently, we're hearing about them abroad at the moment, so in other countries. Will this bivalent updated booster provide any protection against additional variants beyond the B4 and B5?
Yeah, so there is some immunity to the new variants coming out, but like I said before, because the variants change, that is why the vaccine will need to continue to be updated. If we think about flu vaccines are annual. Flu vaccines are based on the variants from the previous year. So the boosters that you will receive will continuously be updated to improve the amount of protection from the variants that continue to be generated by the COVID virus.
Okay. Got it. So in the US, we currently have 4 vaccines available. 2 have this bivalent booster, Pfizer and Moderna. Do people have an option of which booster they receive? And is there a way to help them decide? Is there a reason to choose one over the other?
No, we recommend both the same. You want to definitely look at the age recommendations that I had previously put on one of my slides. So Pfizer is available for a younger subset, 5 and up, whereas Moderna is 6 years old and up. But other than that, no, we're not recommending one over the other. You are able to mix and match. So if you've had Pfizer as your primary series, you can get a Moderna bivalent booster if that's what's available. If you're somewhere where they don't have the Pfizer bivalent, you do not need to continue to have the same vaccine. But yes, it is really important to get those boosters, and we do not recommend like one over the other.
Okay. And I don't know how many people in New York are coming across the Novavax vaccine, but if someone does as an option, where does that fit in with an understanding of fall booster doses?
Yeah, so that's a newer vaccine, and it's not an mRNA vaccine. So it does fall within, you will need boosters, but because they just came out, people are just getting them. So the immunity to that should still be pretty strong at this point because those are new vaccines on the market. So the recommended time frame for boosters has not been released for that.
Okay, so if someone receives the Novavax, they're likely to be receiving the vaccine for the first time. It would be a brand new course of COVID-19 vaccination.
Yes, that is
Okay.
the likely case, yeah.
Okay, thank you. We'll give you a break, Dr. Lynch. Thanks for answering all those questions.
No problem.
I have a few questions for you, Laura. The information environment surrounding vaccines can be quite confusing, and you touched on a lot of great approaches to help communicate and break down some of that information. I'm wondering if you have any general tips on how to recognize misinformation or false information if you were to come across it in social media or in conversation with someone.
Yeah, thanks, Lauren. That's a great question. I am actually going to drop a link to a guide in the chat here. So we have a guide that we co-developed with UNICEF and the Yale Institute for Global Health. That's all about vaccine misinformation management. It goes into great depth to understand misinformation in the context of vaccination, how it spreads, more importantly, how it sticks, and what can be done to mitigate its impact. So feel free to peruse after this webinar, but going back to your question, I think like some of the top 5 things, like to question the information you see online. If you're looking, let's say, like at a tweet and the person, quoting something online, for example, like there's been a lot of continuous misinformation about the link between stillbirths, miscarriages, and not just the COVID vaccine, but a lot of other vaccines. If you look at that tweet, take a look at like who is actually posting it. Like, is the person writing about this, like, are they considered an expert on the topic? Another thing to kind of keep in mind too, like, are there a lot of like grammatical or spelling errors? Like if they say that they are an expert and that they're, putting the word out, about the link between miscarriage and vaccines. See if like are there any other organizations or media that like have written about, whatever they're stating. And that kind of leads to like, is what they're saying, like, is it based on their personal opinion? Now I know it can get a little bit sticky too, if like that person's personal opinion is related to like a personal experience. I know that can be also like really tricky too, because like it's harder to reduce, or it's harder to address like the hesitancy when someone is talking about their lived experience. So that kind of goes into something else. But in general, is it based on their opinion? Are they using inflammatory headlines or like altered images? Like, for example, towards the beginning of the pandemic, and later on into the first round of vaccines, there were a lot of images related to like how the vaccines alter your DNA. And so there was like a lot of pictures of that, and even, showing like pictures of pregnant women and like showing the baby and like the baby's altered, like stuff like that. If there are any images like that, those tend to be, more around misinformation. So again, this guide is like a really great way to just like help triage, maybe that's a better way, triage like those rumors and misinformation. And not only that, like once you identify, it'll also like help you decide whether or not like it's important to address like right on, or is it like, is it worth responding to like online? For example, like you don't want to get into an online like social media war, commenting war, with someone. So definitely like there's wisdom in trying to address that misinformation. And so kind of going back to like the empathy piece, like if you have the opportunity to have more of those one-on-one conversations, then like you'll probably get a lot farther in those conversations and addressing that misinformation and hesitancy rather than like getting in a war online with someone.
Right. Yeah, especially maybe online you'd come across some more strongly held beliefs. So it would just be, there's no conversation. It's just one-sided warring, as you said. So I guess so I'm thinking in more of an offline setting in conversation with individuals who seem to have been either misled or confused by the false information, because it is very confusing if you're hearing one thing and then seeing, especially sometimes very quite convincing false information. How would you help another person sort of navigate that if you found in a conversation some of these misleading beliefs to be strongly held?
Yeah, for sure. I mean, first, I want to acknowledge like that CBOs are in some ways like fighting an uphill battle, like constantly with identifying and addressing this information in their communities, given that the types of misinformation, the types of hesitancy are just constantly evolving. For example, like before the widespread availability and uptake of the vaccines, we were hearing from partners and like what they were hearing on the ground is that there was more information about the consequences of the vaccine, such as like the vaccines will kill you, or they'll alter your DNA, or they'll cause sterility. But as more of like the general public got vaccinated, communities saw that misinformation was baseless to some extent. And so like that was providing more of like a scientific facts. Like I think that kind of gave a little bit like people more confidence in getting the vaccine. But back to what I was saying earlier, like I think the hardest thing to address is when we're shifting away from like the science-based misinfo and more towards negative attitudes and like inexperiences with getting vaccinated. And so that I know there isn't a magic formula, like I wish there was, to addressing that type of misinformation, or excuse me, that type of concern, like such as someone genuinely like getting sick after the first dose, right? And they don't want to get another one, or that they'll believe that they'll be healthy enough to fight the infection. Like those lived experiences can definitely be tough to address, whereas like more of that outright misinfo can be easier to address. Right. And so it kind of just goes back to like having those empathetic conversations and understanding, someone's genuine concern about getting vaccinated. And it also goes back to like using trusted members of the community. I know, for example, there was an organization who had a medical provider that was not only a doctor, but they also identified as being an African French-speaking doctor, and they were able to go into the community as a trusted messenger to discuss things around fertility specifically and the vaccines. And I think that definitely built a lot more confidence in reducing that level of hesitancy, because it wasn't just someone who's identified as a medical provider, but like they had the shared values and cultural experiences that not everyone can relate to. And so again, it's really important to look at and understanding like those personal experiences and addressing those patterns of hesitancy and misinformation.
Yeah. Great. Thanks so much. And that's another great segue back to Shemeka. You shared with us your personal reasons for getting vaccinated and boosted. That has a lot to do with the protection of your children and your family. And you shared with us how you've helped others find their personal why as well. So I'm wondering if, because we were just speaking specifically about hesitancy and how hesitancy can be caused by both exposure to misinformation, but sometimes it's also from personal experience. Do you have any other examples of how you've helped in your role as a community health worker? How you've helped community members navigate their own hesitancy?
Well, it was a senior. I think Miss Rose is about 73 years old. And she was very hesitant because she watched the news a lot, and for her age she was always on social media, and she heard about all the different conspiracies with it, and she didn't want to take it. And it was just like a taboo. You know, vaccine, especially the COVID vaccine, is a taboo in where we live at. A lot of people don't want to take it. They listen to everything that they hear. And like I said, I was one of them also. I was like, I'm not putting that in my body. You know, you hearing that some people was actually thinking other limbs is gonna grow. It was a lot of going on. So once me and her sat down and talked, I asked her why. Like, why don't you want to get vaccinated? You know, I didn't pressure her. And she explained to me why. And she told me a lot of her friends is not getting vaccinated. And what alarmed me most, she was like, hey, I'm 73 years old. What's the point of me getting vaccinated? You know, I'm already at this age. It's no point. You know, just let me be free. Let me live. So I thought about it for a minute because, you know, it paused because I understood where she was coming from, but I did want to lead her to a way to get vaccinated. So then I asked her, did she have kids? She said yes. And I asked her, did she have grandkids? She said yes. So I asked her, do she see them? She said they come see her regularly. So I said, can I ask you a question? You know, without feeling offended. She said, of course. So I said, how would you feel if you had COVID and, you know, not knowingly pass it to one of your grandbabies? And she's like, oh my God, you know, I have a newborn grandbaby. My granddaughter just turned 3 months. I would feel awful. And I said, that's what we're going through now. I said, I understand why you don't want to take it, but we can unknowingly pass it on to our family members. I said, we could be asymptomatic and don't have any symptoms, and we can give it to somebody, and their effects would not be the same as ours. And she was like, oh my God, I don't want to put that on my grandbaby. I understand. So she was like, are you sure that I'm not going to have any side effect? I said, I can't 100% you, but I don't think it would be nothing dramatic. I said, I think it's better for you to get it than not to get it. And she was like, you know what, I understand. And like I said, she was hesitant, but once she thought about her grandbaby, because that was the apple of her eye, that's what made her want to go take it. So that was one of the, and me and her had a great conversation. And she actually told me her daughter was happy because her family was trying to get her to take it for the longest. And she wasn't with it. You know, she was long in the community and she felt it was a no need. Like, I'm here this long. I don't went through this pandemic. I don't went through this epidemic. Nothing never happened. So it's not going to happen to me. It couldn't be me. But once I explained to her that, you know, you could be asymptomatic, that you could walk around and not knowing you have it and you could pass it along, she understood and she ultimately went and got it. And I also helped her to get it to come to her house. So instead of her going to the clinic, they had the ones that come to your home. So I helped set that up for her also.
Oh, that's great. So you helped navigate the home
The home,
vaccination.
yes. Yes, I did. She was actually the first person I helped navigate that for.
Great. That's a really great story. You touched on a lot of elements there. You helped, you had a conversation in which you asked permission to share certain information.
Yes.
You helped her find the reasons why she, you know, the benefits outweighed the risks, and then actually helped her get the vaccine. So, I mean, that's pretty full circle right there. It's a really
Yes.
amazing story. One thing that, because you just mentioned the home delivery system, I'm
Yes.
wondering, have there been other access barriers that you've come across that you've needed to help community navigate?
It was also transportation. So when I was at NYU, it was a link they sent us that they had home cab services that used to help people get to the doctor's office and get vaccinated. Because, you know, some areas didn't have mobile vans. So, you know, some outreach I did, I was able to successfully put mobile vans in some areas, but, you know, that also takes a while to set up. So it was some link, I don't know, I don't want to lie and say if it's still active, but at that time when I was at NYU, they had car services that's to help, especially more towards the elder or, you know, the people who have more infectious disease, to get to areas, to the centers, you know, wherever they feel comfortable to get the vaccine.
Okay.
So that's some of the barriers that I have come across is how to get there.
Yeah.
Some people actually didn't know where to go, especially a lot of seniors did not know where to go. And then some seniors only felt comfortable with their primary doctor. So they can see the mobile van in the area or, you know, the tents, and they don't want to do that. They want to go to their doctor. So that was a barrier that we had to help overcome, especially in the height of COVID, where people didn't want to go out, they didn't want to take public transportation, they didn't want to get a cab. So that was a big barrier for us also.
Yeah, definitely. So the actual logistics of getting
Yeah.
there was challenging.
Because I was scared actually to go out too. You know, before I started working, I was scared to go out in public. I was like, oh my God. But, you know, once you start learning how to protect yourself more, and that's what I also did too. I showed her how to protect herself, you know, how to mask up, you know, always wash your hands. So that's another thing that we had to go through, another barrier.
Yeah. And so if someone was having trouble locating, or they just weren't sure where to go and get the flu or the bivalent booster, what advice would you give them to help them find their locate near their most convenient location?
So a lot of times I was using the vaccine finder,
Okay.
but with I'm in the V4 program now. So we actually have an app we use called NowPal. So the NowPal, we could put in any zip code, and they give us a whole list of resources that we could use. And one of the resources could be medical clinics, places that help you get vaccinated, mental health resources, food. So me and my team, we use the NowPal a lot to help give out different resources and areas in close proximity, how they can get their vaccine and their boosters. So that's a big help with us also.
Okay.
So that's how we can help navigate them to the correct place, because it goes by zip code.
Great. Oh, that's great to know. All right.
Yes.
Thank you. That hopefully that helps some people on the call.
You're welcome.
I'm wary of the time, so I want to shift back to Dr. Lynch for some final questions about the flu vaccine.
Okay.
And you did cover these in your presentation, but someone asked, what are the current 2022-23 flu vaccine guidelines?
So anyone that is over 6 months should get an annual flu vaccine. If you're 65 and older, you should be getting what's called a high dose flu vaccine. And that's because it was shown that higher doses in that population are more effective. So annual flu vaccines for everyone 6 months and older. If you're 65 and up, you should be getting a high dose flu vaccine. And that's definitely something you should do once a year. I also just want to clarify that the Novavax is a monovalent vaccine, so you will need eventually the bivalent booster.
Okay.
You're just not due for it because you have received it pretty early because they just came out. But it is a monovalent vaccine. It's not a bivalent. So you would still need that bivalent booster. I just want
Great. Yeah, thanks for that clarification. We didn't clarify that before. Great. So about the flu shot, still, is there more than one? You talked about the high dose. If you're not choosing the high dose or the normal dose, I guess we could call it, are there different types of the flu shot, and are some recommended more than others?
No, so there's different manufacturers, but one is not more recommended than the other. They're just different manufacturers, whichever one you order. But if you have an allergy to egg, because it does have, it's produced using ingredients of egg, then they do have one without any preservatives, or so you can do that particular one. But the different manufacturers, we do not recommend one over the other.
Okay. So those considerations, what do you recommend if someone wanted to talk through those considerations? Do you recommend they speak to their doctor, to a pharmacist? How can someone help them say if they have the egg allergy? How can they navigate that?
Yeah, so we just ask usually before we administer a flu vaccine, or while you are educating someone on the flu vaccine or letting them know why it's important. You would just ask, there's standard questions you ask. Do you have any allergies with flu? You would definitely ask, do you have any egg allergies? If the answer is yes, then that person automatically should get what's called like flu block, which means like no preservative, or does not have that added
Okay.
agent. But no, we do not recommend one manufacturer over the other. So 6 months and older, annual flu vaccine, over 65, higher dose, because it has been shown to be more effective with building an immune response.
Okay. And you mentioned before that we are now facing a triple threat of flu, RSV, and the bivalent, I'm sorry, not bivalent, and Omicron, COVID. So can someone get the annual flu shot and the COVID-19 vaccine booster at the same time?
Absolutely. So there's no side effects to getting both of the vaccines together. You may experience the same symptoms of maybe some arm pain or just feeling slight feverish or anything like that. And that's just your body building an immune response. If you have children and you take them for vaccines, the doctor always says the baby may be a little bit cranky after receiving the vaccine, their thighs may be a little bit sore. It's the same immune response that children have when they receive vaccines that adults have when they receive a vaccine. So there's no side effects, there's no issues with getting them together. And you may just get the same things that I just mentioned if you get them separately or together.
Okay, great. And we did have some questions come in from the chat. So this is a bit of a pivot, but still about COVID. I'm wondering if you can talk a little bit about what we've heard being called long COVID, and like what is that, and what do people mean when we hear long COVID?
Okay, so long COVID just means that the symptoms that you were having when you were affected acutely with COVID or in the beginning, they do not end. So they continue over weeks, over months, and sometimes people have not gotten over completely those symptoms. They can affect different parts of your body. So if you've had some respiratory complaints in the past, you can continue to have like shortness of breath or cough. Neurologically, some people are using the phrase brain fog. I don't know if you've heard that before, but it's kind of like a mental fatigue. So you feel overwhelmed more quickly than you did before you were infected with COVID. Some other things that you may have is like some digestive symptoms. So people that had symptoms of diarrhea or stomach pain, some of those things can continue or linger on after you've been infected. And then just the routine stuff like joint pain, generalized aches, body aches. These symptoms do not go away. It's still being investigated and looked into on why some people continue to have those symptoms, and it doesn't go completely away. If
someone thinks they're experiencing this, if they think they're experiencing symptoms prolonged symptoms as a result of a previous COVID infection, what do you recommend that they can do?
So they should definitely talk to their primary care provider and just to make sure there's nothing else going on. When you diagnose someone with long COVID, you do want to make sure that you're not overlooking something else that might be present or going on with the patient. So definitely discussing it with your primary care provider, letting them know these are symptoms that you did not have pre-infection, or even if you did, just so that the discussion can be had, and then the doctor can kind of pinpoint what it could be that you're suffering from. Unfortunately, there's really not a specific treatment for these things because they're symptomatic. So it's more trying to treat and work on the symptoms that people are feeling. So we're still trying to figure out long COVID.
Yeah. Okay, great. That's good advice, a good starting point, at least I hope for some people on the call. And I have one final question, and this is back to Shemeka.
Okay.
And this came from the audience. What strategies have you used? And you did speak about these, but if we could hear them again, that have been most successful in overcoming objectives specifically from Black and/or Indigenous communities?
Honesty. That's the strategy I use. And especially from the Black community, you know, I'm African American myself, so I can relate. So I use honesty and I can relate to them. And a lot of the areas I work at is NYCHA. So I'm a NYCHA resident. So it also helps me to relate to them and to get them to trust me. So when you deal with people who look like you, you tend to trust them more. So being that I can relate to them and I look like them and I can understand them and I'm in the same area for them in the same position, that helps me with that community. It has helped them. I just can relate to them more. I can understand. I'm not coming and judging. I'm not coming and looking down or, you know, giving them a whole bunch of statistics. I listen to them first and I can relate and I understand them. And a lot of people just want you to listen to them first. When you come in and you just keep giving them all these facts and not hearing them, that makes them shut down or withdraw for you. So once you listen to them and you understand them and you give them your perspective, listen to their perspective, you found a common ground. So that's what helped me with the Black community, the Indigenous community, and also the Latino community.
Wonderful. Honesty, listening, and finding common ground. I feel like that's a wonderful way to end our question portion. Thank you so much to our panelists. This has been a great discussion. I know I learned a lot. I hope our audience members did as well.